Welcome to the Woman Worriers podcast, where we're working to help you call a truce with your anxiety. The information in this podcast is not a substitute for seeking help from a licensed mental health professional. Now, here's your host, Elizabeth Cush, LCPC.
Welcome back to the Woman Worriers podcast. Thank you for tuning in this week with my guest, Leslie Howard, and we are going to be talking about what she calls the magic of Pelvlandia. So we're going to be talking about the pelvic floor. Very exciting to me. As women, there's a lot that happens down there in our pelvic area, and I think it's important to bring some awareness and talk about these things openly. So that's what we're going to be doing. We'll be talking about her book, Pelvic Liberation. But before we get started, I just wanted to say thanks to all the listeners, subscribers, raters and reviewers, followers on social media. If you would like to be in tune with what's happening with the podcast, feel free to follow us on social media, Facebook, Twitter, and Instagram at Woman Worriers. You can also sign up on the website, womanworriers.com, for bi-monthly blogs that include information about the podcasts. If you have not reviewed or subscribed to Woman Worriers, I'm asking you if you wouldn't mind doing so. In Apple Podcasts, you can click subscribe to this podcast and it just gets downloaded to your device each time there is a new episode. You can also leave a review and rate the podcast there too. It helps grow the audience. It helps Apple know that this is a podcast that women like to listen to. So they share it more often and it goes up in the rankings. So that's important too. So any ratings and reviews, I truly appreciate. And maybe one episode, I will read some of the reviews online. Who knows? It could be yours. If you have thoughts and ideas about what you'd like to hear on the podcast, please reach out to me through womanworriers.com. Click on the Contact Me button and shoot me an email. For those of you who are local to the Annapolis, Anne Arundel County area in Maryland, I will be facilitating mindfulness groups for women this fall. If you're interested, please contact me. You can do that through my website, progressioncounseling.com or womanworriers.com. Click on the Contact Me button and fill out an email and let me know you're interested. So let's get on with the show. Leslie Howard is an Oakland-based yoga teacher specializing in all things pelvic. She leads workshops and trainings nationally and has written a book about the female pelvis, Pelvic Liberation. She is a regular presenter for the Yoga Journal conferences and a regular contributor to Yoga Journal magazine. Her own struggles with healing her hips and pelvis led her to intense study of the anatomy, physiology, cultural messaging, history, and energetics of this rich place. Her teaching is informed by over 3,500 hours of yoga study with senior Iyengar yoga teachers. She considers Ramanand Patel her most important influence and mentor. She has designed 2 very successful studies for UCSF, the University of California, San Francisco, on yoga to alleviate incontinence and pelvic pain. So we're going to jump right in and talk to Leslie about our pelvis and her book, Pelvic Liberation. Hi, Leslie. Thank you so much for being a guest on the Woman Worriers podcast.
Thank you so much for having me. I'm really happy to be here.
Oh, I'm really excited. It sounds so funny. I'm so excited to talk about my pelvis, but no. But I am.
I feel that way all the time.
I'm just excited to talk about your book and just about your journey as well, if you're willing to share some of that. And so why don't you tell the audience a little bit about yourself and what has inspired you, to write this book and to just really be a pelvic advocate?
Well, like a lot of people's stories, you get, things pick you, you don't pick them.
So true.
But I have been a full-time yoga teacher for over 20 years. And I study in the Iyengar method, which is very based on precision and alignment. And but about, I'm going to say like 12 years ago at this point, I was starting to have pelvic pain. And that manifested in that sitting for like more than 15 minutes in any chair was becoming challenging. So driving was actually becoming a problem. And then my husband and I were having difficulty having sex. It was painful. And so that wasn't fun. No. And I was kind of mystified why this was happening to me. And anyway, I'll condense the story. I mean, I outline in my book, but basically I ended up going to a physical therapist that specializes in pelvic floor. And if you specialize in pelvic floor, that means you usually have gone on for more training to do internal palpation. And so I went to her and she examined me and, said, the reason you're having pain is your pelvic floor muscles are so tight, like that's why it's painful to sit. That's why it's painful to have sex. And I was like, what? My pelvic floor's tight?
Right.
Like, I'm a yoga teacher. Like, how is that possible?
Oh my gosh.
But that set me on a, wow, I really need to look at myself a little closer, figuratively and literally. That, I just started remembering all these things that had happened to me and this area of my body. And like a lot of women, I've had some sexual abuse in my past and I'd had surgeries. And as a young person, I had yeast infections and like all these things, just.
Oh,
like,
yeah.
I start my workshops by saying every pelvis has a story and it's, it will help you to actually write down the story of your pelvis because I think it contextualizes anything that might be going on with you. Because a lot of times we vilify our body, we just sort of like, why is this happening to me? And why, my stupid, I hear that all the time, my stupid hip or my dumb,
Yeah, yeah.
Wow, when I wrote down everything I could remember, I was filled with tears, but compassion for my body. I was like, wow, I've put my body through a lot, or my body's been through a lot.
Yeah.
And it's the whole yoga principle of that there's no separation between mind and body. And
right.
So, there's some really good pelvic floor books out there that are technically fabulous, but there were no books talking about the emotional component of it and the, just like putting it all together.
Yeah. Well, and to me, the most amazing, whatever aha part of the book for me, I will admit I have not read the whole thing, but I've glanced through most of it.
I say, read the parts you need to read is what I say.
Yeah. But to me, just your validating or acknowledging or just putting out there that as women, like our pelvises go through so much, especially because so many of us have had, whether it's sexual abuse or sexual assault or some sort of trauma, a miscarriage or a whatever, there's just so much potential for. Yeah.
Yeah, it's not that men don't have pelvic floor problems, they do, but I think women's pelvis is just because of menstruation and birth and pregnancies and just it's a little harder.
Yeah. Well, and so, I'm a trauma therapist and so much of your trauma gets stored in in your body, but also in that pelvic area.
Yeah. And, until very, very recently, like most people don't even know it's there, like it's never talked about. It's like, I travel with a model, 3D model of all, of a pelvis with all the muscles attached, and people are like, wow, how come I've never seen that before?
Yeah.
We've all been to the gynecologist where they have like a model of the uterus, right? I mean, like that's like in every gynecologist's office, but the pelvic floor muscles, no. And they're actually voluntary muscles that you can, if you practice, you can get in touch with them and you can stretch them and strengthen them just like our biceps and our hamstrings,
Yeah. So crazy.
Yeah.
So I had not even heard of the term pelvic floor until I did a like 8-week-long meditation for health practice. And they talked about, breathe into your pelvic floor, and talked about it being like your diaphragm and,
Right.
So talk to us a little bit. What is the pelvic floor? Why do we need to know about it? What's important? All of that.
Well, gosh, it's so important because it holds up our internal organs. I mean, it's the bottom of our. If you think the torso is like a grocery bag, it's the bottom of the bag. So don't want to have too many holes in your bag. We have a couple holes in our bag, so we need our pelvic floor to be the reinforcement, for when we're in movement, for sexuality, for defecation, for urination. I mean, everything's attached fascially. So it's important from that standpoint. But I would say even more important, if I can say that, is I think the pelvic diaphragm, which if I call all the muscles together, the pelvic diaphragm, is really where the breath originates. And you can say, yes, you breathe into your nose, into the lungs move the respiratory diaphragm, and that's all true. But it needs something to reflect off of. And the pelvic floor muscles are what's in conversation or in response to the respiratory diaphragm. So important for breathing, for good breathing. Mm-hmm. And many of us are very constricted. I say this as as a recovering gripper.
Restricted.
So many of us are very clenched and tense and shut off from that area. And so then our breath becomes shorter and less efficient. Mm. Our emotional state is connected to our breath. Mm. When we're upset, we go into hyperventilation or short breathing, and people say, calm down, take a deep breath. Well, if your pelvic floor is really tight, guess what? You can't take a deep breath.
Right.
That's actually something you have to work towards. Mm. I don't know if you want more of an anatomical answer. I can do that as well, but, like what the pelvic floor is, but...
to just give people an idea of kind of, yes, we know where your pelvis is, but like where is the pelvic floor in your body?
Okay. So the pelvic floor is located between the pubic bone in the front, the tailbone or the coccyx in the back, and the two ischial tuberosities. In yoga, we call them the sitting bones or sits bones. You'll hear those terms. And if you think about those 4 points that create a diamond shape, and the pelvic floor muscles are basically attached to those bones. So you've got 3 layers of pelvic floor muscles, and the first, most superficial one runs from the pubic bone to the tailbone. Mm-hmm. Then the second layer runs from the sitting bone to the sitting bone. So front to back, then the left to right. And then the third one connects more front and back. So again, connecting behind the pubic bone and to the sides of the coccyx. And so they hold up everything, really.
Yeah. And so, you've talked about it, what I've identified for myself is that my pelvic floor is pretty tight, and I know there's a lot of really good reasons for that from my history. But, and so that can contribute to like painful sex, incontinence, yes, feeling like you have to go to the bathroom all the time, urinating frequently.
Irritable bowel syndrome, interstitial cystitis, pelvic pain syndromes like vulvodynia, vaginismus. But so many women don't even know they have some of this stuff. They're not putting it they're not connecting it with it because we don't talk about the pelvic floor enough. And again, that's changing.
Yeah.
I've been teaching this for 12 years now, and it's totally changing, but it's slow. The medical world is a little slow to change. So I'm going to say pelvic floor physical therapists know way more about this than your gynecologist, which seems crazy.
Right.
Right. So, how many pelvic exams did I have where it was painful? And the doctor never, had the doctor said, you have a little bit too much tone in your pelvis, that might have, set me off in a different direction.
Yeah.
But never was I told that. It was like I was kind of told, hey, can you relax more? Well, I guess not.
Right.
Nothing to compare this to. I thought I was relaxed.
Right. Yeah.
Yeah.
And so too, like, there's the too tight, but then, and
you can be too loose, but that was, for so long, that was kind of the prevailing thought out there that, oh, you're getting older, gravity. Okay. Oh, you've had a couple, kids. Oh, pelvic floor. It's probably like, kind of like a stretched out hammock.
Right.
And that actually can be true. But I find in the world that I teach in and live in, which is, of course, more yoga people. So it's more active people, I would say, people that are, maybe coming to yoga because they're anxious. I find much more people being in the tight category than the loose category. And it's really important to remember that tight does not equal strong. A tight muscle is a weak muscle. It's a muscle that cannot work. So you can have a loose muscle that cannot work. You can have a tight muscle that cannot work. They're the same. They're just a different manifestation of the same problem.
Yeah.
So,
so tight or loose isn't necessarily better or worse. It's just we want it to be neutral or.
And then to keep things spicy, you can also be a little bit of both. So you could actually have one side of your pelvic floor that's too tight, and then the other side, in response to that, has twisted a little. If you could follow the tailbone being pulled in one way or the sacrum being pulled in one way. So then one side is stretched out and the other side is really tight. And so that's not uncommon either.
But too, as you said, that, this sort of common myth or whatever, that as women, as we get older, our pelvic floor loosens, and it's totally normal to urinate when you cough or sneeze or laugh.
Right. Yep.
I know at every gynecological exam I have, they ask, so are you leaking when you cough? And I'm like, no, I don't, but should I be?
Right. Well, you're lucky. And then unfortunately, though, I'm glad they're asking that, number one, but if you had said yes, I can't tell you the countless times students have told me, and then my doctor told me to do Kegels, and they're too tight. The person is too tight. They're having incontinence because they're too tight.
Wow.
Which, again, you think things are leaking. How could it be too tight? But if your muscles are too tight, they can't work properly. So they're stuck in a shortened position. They can't help you.
So Kegels are only making you tighten it up more.
Totally. I can't tell you how many people I've seen that come to me, oh, I'm leaking. My doctor told me to do Kegels. And I'm like, oh my God. Okay. After asking them more things and looking at their body and going through some yoga poses, it's like, this person's too tight. So I was like, no Kegels for you. Stop doing it. They can be counterproductive if done with the wrong condition, as well as I'm going to say that in my experience teaching, people are like, Kegels, what's that? Squeezing everything. This is what I hear. Squeezing everything. I'm like, squeezing what? Well, down there. And so, people could be squeezing their butts and not really realize it. People could be squeezing their anal sphincter and think they're squeezing their whole pelvic floor, but really it's just the sphincter, So, some of my teaching is you got to really slow down and really feel what's going on. Like when I think I'm lifting my pelvic floor, am I lifting my pelvic floor? My physical therapist that I talk to, refer back and forth to, they tell me that 1 in 3 women, when they're asked, they're in the office with the PT, show me what you think a Kegel is. 1 in 3 are bearing down, and they think they're lifting up.
Oh, wow.
Yeah. So, I get emails like, I'm doing 100 Kegels a day. It's making things worse. Can you help me? Stop doing Kegels. So I suggest to my students, get a mirror out. Do what you think a Kegel is. See what's happening down there. Is anything moving? Are you bulging out? Because that's not productive.
Oh my gosh. Yeah. So really be getting familiar with like what is down there and what am I doing?
Yes, and culturally we don't support that. And also, let's just face it, women's anatomy is not as accessible as male anatomy.
That is the truth.
So it's like, we got to get the mirror and the flashlight. We got to get ourselves into some contorted position. Depending on your body architecture, you might be like, okay, I'm going to put the mirror on the floor. And I'm just, it's not easy.
Right. And put my glasses on so I can see what it is I'm looking at.
Right. And make sure that all the doors are locked.
Oh my goodness. So pelvic tone can be a combination. It could be one or the other, but if we're not more aware of what the tone is, then we could be having these symptoms that are completely related to it, but we're not aware of that.
Correct.
Yeah. And so how does yoga help? How do you help the clients that you work with, get better and tuned and tone their pelvic floor?
So the people coming to me can vary from, hey, I did, a search about pelvic floor and I found you, and they don't have a diagnosis. They have symptoms, no diagnosis, as well as I've had people who've been to, I've been to 10 doctors and I finally just figured out that my pelvic floor is too tight or something like that. Mm-hmm. So it varies person to person. So the first thing I look at is what are their symptoms? Because symptoms will often tell you what's really going on. And then looking at their mobility of their pelvis, legs, lower back area. And then, I've developed a couple different ways to try to heighten your awareness of this area. Mm-hmm. And so I think what's different about yoga than going to the medical world, not that you shouldn't go to the medical world. And again, pelvic floor, if you get a pelvic floor PT that knows that's good, they're worth their weight in gold. Yeah. They can do things I can't do legally.
Right.
But, a lot of them, they only have 3 visits or something and by insurance. So they often get passed to me. Or they might start with me and I say, you got to go see the pelvic floor PT because, you need both. Right. But what yoga can do is empower the student, the patient, whatever you want to call them, the client, to take control of their own health and to tune into their body on a much more subtle level. If you go to a PT, let's say, you strained your knee, and they're going to give you do these 3 exercises and that'll strengthen this muscle around your knee that's giving you a problem, right?
Right.
And so that's kind of the medical approach. That's the medical model. So you go to a pelvic floor PT, they're doing a little bit more comprehensive because they're doing internal work, and they may encourage you to massage your own internal muscles, which I highly believe in. Mm-hmm. But again, they have an hour, whereas, if they come to me and I give them a yoga program to do, that's a little more comprehensive than going to the PT. The best thing is if you can go to a pelvic floor PT and get a diagnosis so that you don't have any doubt of, what we're working with. But yoga, I can give you a full yoga program. We can, put poses in, take poses out. It can be a little more tailored. And I think more empowering. If you're going to a PT, you're going to them for them to help you do the work, right? Hopefully, if you're coming to me for yoga, I'm saying to you, one of the first things I say is, be honest, how many minutes a day will you do this? Because if you really only have 10 or 15 minutes a day, good, glad. Tell me that's the truth, and we'll come up with a 15-minute program for you. But if you have an hour, okay, we can do so much more. Yeah. Or how about I give you 2 different programs and you only have 15 minutes a day, but you do this one every other day and you do this one every other day. So, yeah. And I think the cueing for yoga is a little more mind-body.
Mm-hmm. Yes.
medical profession. And so,
Yeah.
you know, we don't need any more proof that they're connected. And I'm not saying that PT doesn't connect mind and body, but
that's what yoga does. Like that's
what yoga does. Exactly.
Yeah. And so I know that in the book there are actually, you know, exercises. You have very clear sort of step-by-step instructions on some of the poses and things that you can do to help you tone your pelvic floor. Are there
relax it.
Or relax it, right?
Whatever you need,
Whatever you need. Are there other resources out there that you feel like would be important that, you know, obviously your book is an amazing resource, but are there other resources for people who want to know more about pelvic floor tone and, or, you know, working with their pelvic floor?
A pelvic floor PT, a pelvic floor physical therapist, and not everybody has one in their area. You know, like in the Bay Area where I live, there's a lot of them. But if you live in, you know, a small town in maybe Indiana, there might not be one. You might have to drive 2 hours, which is going to eliminate all the benefit you had of going. You know, drive 2 hours, right? So, you know, there's a lot of online resources. I have online classes.
Nice.
There's a PT named Isa Herrera. She wrote a book about pelvic pain from a PT perspective that I think is pretty good. You know, it goes into more technical detail than I do. So if you wanted to learn more, let's see, what else? I mean, there's a couple books on pelvic floor out there besides mine. I would say Isa's is my favorite. And then if you want to explore the emotional side of it, there's a book that has no pictures, no technical, called Wild Feminine, which is all about like the emotional side of it.
Oh, wow. That's cool.
Yeah.
Well, and I think
my book was trying to be a hybrid. It was kind of like, okay, there's nothing out there that does both. It's this one that has no pictures, no like technical descriptions, no poses. And then there's the one written by the PTs that are like very
all technical. Yeah.
So.
And I, you know, for me, I think I thought having the pictures was super great, but I also liked your personal stories and sort of the exercises you include to help you kind of just have a better way of, connecting and connect the dots into like, you know, why maybe my pelvic floor is super tight or not, or whatever.
Right.
Yeah.
Right.
Connecting the emotional with the physical.
Yeah. It's so common I do a training also for yoga teachers or PTs or midwives or whatever. You know, a lot of different people come, but I do a training how to teach the pelvic floor yoga that I've developed. And so many of the students have come to me saying, you know, I came to this training because I was thinking I want to help women with this issue. And I realized that I actually have an issue. Like they would come not even realizing that they had a bunch of stuff going on. And they're just kind of like, wow, like, you know, this so opened my eyes.
I believe it. I believe it. Because we're just so out of touch with that part of our body, really.
Yeah. I know. The culture we live in is very bifurcated. It's, you know, it's like sex, and babies. And besides that, though, you know, don't talk about your pelvis. If anything's going wrong with it, we don't really want to know.
So true.
Yeah. So, and then I think it creates a lot of shame and embarrassment in this area. And I'm just out there like saying, let's just talk about it. It's just another body part. Okay.
Yeah. Right. And it doesn't have to necessarily conform to whatever social pressures we are feeling these days about how it should look and smell and behave.
I couldn't be happier about the Me Too movement. And there's the Wall of Vagina art project, which I think is awesome.
Oh my gosh!
If you don't know about the Wall of Vagina, check it out.
I don't.
It's a male artist, but he's got a great story. He said, my girlfriend was complaining about what her vulva looked like, and I said to her, like, how many have you seen? Like, you know, like, why are you not happy? You know, he's like, this is so messed up. Like, really? And so he did this art project where he asked for volunteers, and he got 600 castings of different vulvas, one by one castings, and he put them on a wall. And he's like, you know, women don't get to see what other women look like, and they think that something's wrong with them. And he's like, you know, vulvas are just as different as, you know, faces.
Right, or penises, right? I mean, they're not all the same either.
No. So I thought that was a really great, very empowering art project.
That's very cool. I will provide a link in the show notes to that.
Yes, I'm pretty sure there's actually a little YouTube video on it.
Oh, that's cool. Well, I just wanted to read, before we explore how people can find you, I just wanted to read a little quote from your book. You say, we all know that body language is an important part of how we communicate with others, but recent research reveals how much body language also communicates to the self. It not only tells others about who we are, but it in turn shapes the way we think and feel about ourselves. And I just feel like that just, I don't know, it just, if we're not tuning into how our body is feeling and what we're thinking about it, like it's hard to really be in touch with ourselves. Does that make sense?
Yeah, it totally makes sense. And I mean, I have so much to say about that. I don't know where to go. But in my last newsletter, I just wrote about, you know, how posture, like the posture of the iPhone posture, you know, the head forward. You know, the impact of that on the pelvis is if your head is forward, you basically are sitting on your tailbone, which is, if you do that enough, your pelvic floor will just decide, oh, I guess I'm supposed to be this far forward. I guess I'll just shorten up so that I'm in this like permanent position of pulling my tailbone forward.
Oh my goodness.
And I see that a lot. So I see the youngsters with their phones, and I just like go, oh my goodness, what are we doing to our pelvises?
Yeah. And and it's funny because, you know, I've been working with one of your students, Julie, and it's got me really thinking about how, like, I sit all day because I'm a therapist, and I'm like, my chair is terrible for my pelvis. Right. Yep. I need to start looking for a better one.
Yeah. I mean, like, we all have the classic, you know, picture in our head of like a depressed person, right? Their chest is collapsed. Right.
Yeah. All sunken in. Yeah.
So like our emotional state, you know, again, did the emotional state come first, or did the posture come and give and contribute to the emotional state? You know, I think these are questions that are unanswerable, but they're certainly worth pondering.
Yes. And can posture help change our emotional state?
I think so. I definitely mention in my workshops how, like, you know, think about, when does a dog sit on its tail? When it's afraid, when it's ashamed.
Right.
You know, is there an emotional component to us constantly pulling our tail forward and under us? Yeah, I think so.
Yeah. So let's wag our tails a little bit more.
Totally. That's definitely in my campaign. So if you had a tail, what would it look like? And wear it proudly.
Exactly. So how do people find you, Leslie?
Well, easy to remember is pelvicflooryoga.com. You can find me that way. It'll get you the same place as lesliehowardyoga.com, but you might not know how to spell that. So
awesome.
Yeah.
And your book, Pelvic Liberation, I'm assuming, I mean, I got it on Amazon, so I'm assuming.
It's available on my website if you want to support small businesses.
Oh, very cool.
But also available on Amazon. But I provide free shipping too, just FYI. Nice. And it's also, you can get it on Kindle. So if you're an e-reader, it's Kindleable. So those are ways to get my book.
Cool.
Yeah.
Well, I will provide links to your website and the book and all the resources we talked about. Do you have anything that's coming up in the near future that you would like to talk about in your business?
Well, let me ask you, who is your audience?
So my audience is anxious women, women who worry, people who are overwhelmed, overstressed, overanxious. And right now, I would say I have listeners in Canada, Great Britain, and the U.S. So that's primarily my audience.
I do workshops, my general workshop, kind of my introductory workshop all over the world. And so you can find my schedule on my website. But I also have been training people to teach this method. And I have a list of those people on my website. So it's listed by state and country. It's not huge, but it's not small. It's growing. Yeah. So if you're interested in actually experiencing a workshop, you could either come to one of my workshops or one of my students' workshops. And if you're as I said, a yoga teacher, a Pilates teacher, a midwife, doula, physical therapist, enlightened doctor, those are all the people that make up my training. So I have a training coming up in September, a 20-hour training. It's 4 days. And, we delve deep into the subject and we go through all the therapeutic application of yoga and breathing practices, which, I did talk a little bit about the pelvic floor and how important it is to breathing. But, a lot of us are just really bad breathers and don't even know it.
Yeah, yeah.
And that's a huge part of anxiety is our breath pattern.
Oh, yeah. When you're all stuck up in your chest and shallow breathing. And
exactly. And breathing fast.
Yep.
Yeah.
Yep. Yeah.
So.
Yeah. All right. Well, I will also provide a link to that training. I assume it's on your website.
It is. And I appreciate your supporting my work and supporting all the anxious people out there.
Yes.
Yeah. There's much to be done.
There is. Yeah. There is. So every little bit helps. And I just really appreciate your taking the time. I know you were on vacation, but I really appreciate your taking the time to talk to us today.
Happy to do it. Let me know if you have any other questions. And thank you.
Well, that was really great. I so enjoyed talking to Leslie about our pelvis and the pelvic floor and why it's important to get a little bit more in tuned with our pelvises because they can create some anxiety for us. If things are painful or we're urinating when we're coughing or sneezing or sex is painful or whatever, if we are not exploring what's going on for our bodies and ourselves with compassion and curiosity, it can feel really overwhelmingly anxious or overwhelmingly stressful. And I just think exploration, talking about bringing things into the light really helps us normalize what's happening for us as women in this over-anxious, overwhelming, stressed out world. So I hope you got something out of that interview. If you want to know more about Leslie, please check out the show notes for links to her book, her website, and her trainings. I also wanted to mention that one of Leslie's current students is my private yoga teacher. Her name is Julie Blamfin of Stretch Your Spirit. Julie will soon be launching a program called Celebrate the Pelvic Floor. You can find out more information on her website at stretchyourspirit.com. I hope you all bring some awareness to your magical Pelvlandia in this coming week. Ciao for now from this Woman Worrier.
Thanks for listening and subscribing to the Woman Worriers podcast. Music was written and performed by Andy Cush. If you'd like more information on this episode, you can find the show notes, the resources shared today, and links to the guests' profiles at womanworriers.com.